Hello everyone, I'm Dr. Sri Banerjee, epidemiologist, biostatistician, faculty member. And in this segment, I'm going to be going over something called Epicrim. The way I define Epicrim, and this is something I've gone over in previous videos, the way I define this is kind of on a simplistic term, is sort of a melding of epidemiology and criminal justice / criminology. How does this work? Well, the example that I provide is that in one way you can incarcerate all the people that are committing crimes, and then there's a lot of recidivism where once they're imprisoned and then come out again, they're likely to do crimes that land them in jail again. So how do we prevent this vicious cycle, number one? And then number two, how do we even prevent people from committing crimes and becoming upstanding citizens instead? So prevent before it happens. And that is really the motto of public health. And this is the reason why public health needs to broaden the scope, and then criminal justice criminology has to be open to the possibilities of public health and epidemiology. So this is kind of the context behind which this article was written. This was actually from the University of the West of England, and this is from Bristol. So these authors, Karen McCartan and then Hazel Kempschall, they talked about applying Epicrim to sexual abuse. And this is quite recent, actually, was published just last year. So the previous talk that I gave, this was more than a decade old. However, here, this application is much more recent. Anyway, so looking at Epicrim application to sexual abuse, and this actually applies to many different scenarios. The key principles of quaternary prevention are adapted and refined from current medical literature, and the potential usefulness of quaternary prevention to crime and sex abuse. And I'm going to go into this article, and I'm trying to keep it brief so that you can kind of go through this. So for the longest time, the crime and sexual abuse, all of this, sexual offenders, they have been largely focused on the individual and the interrelationship of the individual to families and networks. However, what the impact is that the person who has committed the offense, often being the sole subject of the response, rather than taking a more holistic approach that incorporates society as well as the individual. So again, this is going into the notion that you can't just blame the individual. You have to kind of look at society, and then only can you prevent things like sexual abuse and commitment of crime and some of the other areas that are being explored here. So this is going into the intersection of public health and criminology, and one important statement that was made was by Young, 2003, and he described the criminology was on the busy crossroads of sociology, psychology, law, and philosophy. And so in the 80s to 90s, there was an increasing melding and then between these disciplines. And then by the turn of the 21st century, then public health in particular began to make an important contribution to understanding crime causation. There's a lot of research on crime causation, life course analysis. So what happened to individuals, offenders as children, as they develop into grown adults, what might they have been exposed to? And understanding that, going beyond, is part of understanding Epicrim. So this would be a more holistic response to crime. This is a nice visual going into the behavioral disparities, health behavior, criminal behavior, and then biomedical disparities. And this goes into the biopsychosocial, and then also providing overview through socio-ecological model. So what I'm going to do here now is, and we've already gone through a lot of this, a lot of the theory. I might need multiple videos. However, just briefly looking at this, similar to what I had mentioned previously, Epicrim approach revolves around two key assumptions, and this is relevant to criminology. So number one, the application of socio-ecological model to enable the understanding of criminal behavior across the full societal and social spectrum. Number two, the need to examine offending and related behaviors from a preventive, public health, and developmental perspective. And one of my colleagues actually wrote a dissertation on Epicrim and integrating that to criminology and criminal justice. I'll go into primary prevention. Primary prevention is intervention before health effects occur. And so risky behaviors, poor eating habits, tobacco use, intervening before. Secondary prevention is screening to identify diseases in the earliest stages before the onset of signs and symptoms. And then tertiary prevention is managing disease post-diagnosis to slow or stop disease. So we want to be more in primary and secondary prevention rather than tertiary prevention, where treatment is taking place. So again, this goes into a lot more detail, and then the quaternary approach that goes into ongoing supportive intervention that streamline criminal justice response to reduce risk of sexual offending. So this goes into a lot more detail about quaternary prevention, where it focuses on the prevention of the potential or actual over-medicalization and over-treatment of patients. And that is a very important difficulty that people face in incarcerated patients. So the principles are do no harm, and that is something that is part of the medical that is part of the medical ethics. And this is important, non-stigmatizing interventions and treatments. Again, avoidance of over-medication, adopt ethical principles for interventions, critically evaluate stance of all programs, take a service user-focused approach, and again, biopsychosocial model is always important. Also, evidence-based approach to cost-benefit calculations of prevention. So for instance, if you, this is a very important concept, if you have only a few individuals within the population of rare disease, then that doesn't necessarily benefit the whole population. And so you have to weigh the cost and the benefit from screening or overly screening versus how much that would cost to society. This is a really good article. It really provides an overview about what Epicrim stands for. And they end with rethinking punishment and rehabilitation, and to consider desistance, not control, working within a person-centered approach focused on desistance supportive work. So the concept of desistance, or the pains of desistance, is that to understand crime as a career criminal as a process where there's going to be some relapse, rather than understanding each individual crime for its own. This also talks about the constraint, resource constraint because of COVID-19 pandemic, and this is something that public health practitioners and other social sciences face very often, where public health and in terms of wanting to devote resources are lacking in some of these places. Finally, the average cost, and this goes into England, is actually really high. And they talk about £43,213, and on probation £2,380. Just to give you an idea about the cost. I hope this has made some sense. Thank you for listening.